Do you suffer from some kind of pain every day, whether it's headaches, pain in your neck or back, muscles, or your joints? Have you been diagnosed with fibromyalgia or some other type of chronic pain? Maybe you've been in an accident and suffered trauma to your body in some way. And you've tried every treatment available. Some have worked for you and some haven't. But you're looking for something new. Well, this edition of Healthy Living may have that something new for you. It's a form of physical therapy called PRRT. Are you interested? Well, stay with us and we'll be right back. Welcome to Healthy Living. I'm your host, Tammy Thompson. We're going to be talking about a form of physical therapy on this edition called PRRT. And here to discuss it with me is Gary Brown, a local physical therapist, to talk about what PRRT is. But before we get started, I just want to know a little bit about you, Gary, a little bit about your background. What brought you to Paducah and what brought you into physical therapy?
Well, I graduated from physical therapy school in 1971, and I've basically been associated with small hospitals through most of my career, and then moved to a regional medical center in Madisonville, Kentucky. After a period of time, pursued some other business interests, and then the Lord called me back into physical therapy again. And so I started a physical therapy department at the Crittenden Hospital in Crittenden County, and then moved to the Livingston Hospital, Livingston County, and from there, as an extension of that, I've opened up clinics in the other surrounding areas, one in Reedland and one in Draftonville. Okay,
and I've seen a lot of news stories in researching this and stuff that you've sent me about PRRT, and they've just been really short little snippets, 2 and 3 minute things, and I haven't seen anyone dedicate a whole hour to what you do.
Right.
And that's what we're going to do on Healthy Living. So let's start from the beginning. What is PRRT?
PRRT stands for Primal Reflex Release Technique, and what you're doing is you're trying to release very primal reflexes that we have at birth.
And who started all of this?
This was started by a physical therapist in Poway, California. His name is John Imes. He has his master's in physical therapy, and he stumbled into this concept about, I think, 8 to 10 years ago, after a lot of research and a lot of dedication to looking at different ways to help people with pain. And as a result, started looking into the primal reflexes as to how they might influence pain.
Okay, and 8 to 10 years, that's fairly new, would you say?
Oh yes, very new.
So are there a lot of people who practice this in this area?
No.
Because I've never heard of it until you and I spoke. I'd never heard of PRRT.
I'm the only practicing PRRT professional in about a 5-state area.
5-state area. So it is relatively new, and around in this area, you're the man.
Right.
You're the man. So you talked about these primal reflexes.
Right.
And you said we have them at birth. They're hardwired into our central nervous systems, right? What are these primal reflexes?
Well, there are two. One of them is the withdrawal reflex, and that withdrawal reflex, when the baby is still in utero, is usually developed somewhere around 7 to 8 weeks, and the baby will withdraw from uncomfortable stimuli even at that early age. So when the baby is born, one of the first things the doctor does in the nursery is he pushes on the bottom of their foot and sees if the foot will draw away, and that's a very primal reflex to protect yourself. The second one is the startle reflex, also called the moral reflex, which is what it's called in infants. And the doctor will come in and he will clap his hands over the baby, and usually the baby will jump, and that shows that that reflex is intact. Those two reflexes are extremely primal. In other words, they're very deep in the nervous system, and they have to be there in order for us to live and survive. And so,
and why is that? I mean,
why is that?
Yeah, I mean,
if you didn't have a startle reflex, or if you didn't have a withdrawal reflex, you would injure yourself terribly.
Well, I understand that withdrawal, something's hot on the stove. You're going to withdraw from that.
Right.
But what is the startle? How does that?
The startle reflex is tied in, I mean, all of this is tied into your autonomic nervous system. Now, you have a nervous system that goes up and down the spinal cord, the brain and the spinal cord. That's the central nervous system.
Okay.
You have the peripheral nervous system that goes from the spine out into the extremities and into the trunk. And then you have the autonomic nervous system, and that's the nervous system that controls how your heart beats and how your stomach digests and how your bowels work and your bladder. And also it has two sides. It has a side that creates relaxation. It also has a side that can be overstimulated, and the overstimulated side is what you're testing when you do the startle reflex. You're seeing, does the baby have what they call fight or flight?
Okay.
So if you're caught in a very, you're caught in a situation where you might be injured, are you going to stay and fight, or are you going to run? So the adrenaline that is needed in order for you to do either one of those has to come from somewhere. That comes from the autonomic nervous system, that comes from the adrenal gland, which sits on top of your kidney, and that then shoves adrenaline into your system to do one of two things, fight or flight. The problem is when people have pain, either as a result of trauma or stress or disease process, whatever the case may be, it overstimulates that sympathetic side, and the body doesn't know whether it's supposed to fight or flight or not. It's just when it gets stimulated, it stays revved up. So the pain itself can be attached to that startle reflex or that withdrawal reflex and make it more excitable than what it should be.
And so that kind of answers my next question, how the reflexes fight against you sometimes.
Well, they really don't fight against you. They're totally protective in nature, but they can be overstimulated, and then they don't know how to let go. So instead of the autonomic nervous system being balanced to where you're more in a, where you can relax yourself easily, or where you can excite what needs to be excited in order to protect yourself, typically because of what has happened to you, the sympathetic side or the excited side is staying overreactive compared to the parasympathetic or the relaxing side.
So how did you get this training? How did you learn, how the reflexes, how important this was to what you do in physical therapy?
Exactly. I've been doing physical therapy for 36 years, and it always used to kind of bother me that I could do just so much for certain patients. I could only get them just so far. I could do things that might be helpful for a little while, but all of a sudden their pain would return. Or if I did something that helped for a few hours, the next time they came back they were worse. Or in some cases, I would do something and they felt great when they were in the clinic, and 2 or 3 hours later they were hurting worse than they were when they came in, so they would call and say, I'm not coming back, because they were thinking that I was hurting them. So people are very responsive to their pain.
Yes.
as an indicator as to whether you're doing the right thing or not. And so I read this article in the Advanced magazine, which is a magazine for physical therapists and PT assistants, and it was called Reflexes Rule and Can Be Cruel. And it was enough to pique my interest because I didn't really understand what John was talking about when he wrote the article. I understood the words, I understood the concept, but to have it, to mix it into what I was using, what I wanted to use in the clinic, I had to see more. So it piqued my interest, so as a result I ordered his home study course, and from that learned some basic techniques, utilized those techniques after studying the home study course on one weekend. And one weekend, just taught 9 techniques. And out of those 9 techniques, I used them the next week in the clinic, and I had 10 people with dramatic pain reduction in that 1 week period of time. And I was just blown away with how much difference it made. And I could give you some examples if you want to.
Well, you're going to give an example here in the next segment because I get to have PRRT tested on me to see how it works. So before we do that, tell us how it does work first.
We really don't know. That's the interesting thing.
Well, that's not the answer I wanted, Gary.
I know it. There is a top researcher in Maui, Hawaii, who is a PhD and MD and is a neurophysiologist. So he studies nerves and the physiology of the nervous system, how it works. And he came and took John's course. And after the course was over, John was going to pick his brain, tell me what I don't know. And this guy said, I can sit here and give you all the details, of which most of you know already, but he says, we don't know how to use it. We don't know how to treat it. We don't know how to make it applicable to the patient. You figured out how to treat it. That's more than we know. So we've got a method that helps the system right itself. So it's like, if you have a piece of equipment and it has a reset button on it and it's not working right, you punch the reset button and everything kind of squares away and it works correctly again. That's basically what you're doing with PRRT, is you're using these techniques to help the body reset itself so that it can work more appropriately.
Okay, now, one of the questions that I have is that I've watched some of the videos that you've given me, and when I first saw it, I thought, now Gary, come on. This has got to be some type of gimmick, some type of hoax. This cannot work. How do you respond to that? And how does it, because you are a physical therapist and it's only new, 8 to 10 years. So you practiced what maybe standard physical therapy techniques before.
Right.
So how does this relate to what you knew before, and how does it?
It's a missing piece. There are lots of different ways that you can approach the pain puzzle. Different people may go to the physician to get medication. Some seek chiropractic help. Some seek an osteopath. Some seek massage therapy, acupuncture. There are a variety of different ways that you can attack the pain problem. Pain management may be another way that you attack it. Physical therapy is another option. So the traditional physical therapy methods, which is what I was trained in, I found limitations in that. It just didn't quite get me where I needed to be. PRRT helps to fill in that gap, and it's a much bigger piece of the pain puzzle because nobody has ever looked at the startle and withdrawal reflexes being attached to the pain problem. And so when you have a heightened reflex and pain is attached to it, if you can decrease the effect of that reflex, the pain has nothing to attach to and it goes away. It's about the best example I can give you.
Well, how do you know when someone needs PRRT and when they need standard physical therapy?
It's difficult to know that just from a history. But you can take a history, and then we do what I call a 1 minute, what John calls a 1 minute nociceptive exam. Nociceptive means pain. You're looking for pain regions. Some people are familiar with trigger points, and trigger points are areas of hypersensitivity within the muscle that you can push on, and they will refer pain to different areas of the body. We're looking for trigger regions, and these are outside of the trigger points. They don't correlate with trigger points. They're
now,
trigger
the trigger
regions.
points, isn't that something with acupuncture? Something where they find something and they poke you here, but the pain may be someplace else that they're treating.
Exactly.
And that's not what this is, though.
No.
Okay.
No. Acupuncture is where you puncture the skin with a needle.
Right.
Acupressure is where you apply pressure, and we can do that. We can't puncture the skin as physical therapists. But PRRT, what you're looking for is you're looking for where the withdrawal and startle reflex is showing itself in regions of the body that create withdrawal and startle responses in the patient when you touch them. And if they have that, then that's a positive. So there are several areas in the body that we look for that to be present.
Like?
Oh, you start from the tailbone and move all the way up to the top of the head.
And is the pain always where the regions are, where they startle, where they withdraw? Is that where the pain is?
They'll be within those regions.
So it's not going to be someplace else, because when I did a show on acupuncture, and they did, and it was in your head when they poked you in your hand, or something different. So it's going to be in those regions that you're working, where someone would startle or withdraw. In those regions is where their pain is located.
Yes and no.
Yes and no.
You may have if you have problems with your low back, and I find that there is a positive nociceptive response in the low back, I may treat your head, I may treat your neck in order to take care of that.
Okay.
So the interesting thing is when you start looking at how the nervous system is put together, there's so much that goes on with the way the good Lord put us together from the neck up, and how that all works and how it all ties into the rest of the body. So that is an integral part. Now, if you treat that area and you have some effect but not a total effect, then you can move down and treat it peripherally or outside of the head-neck area. But the head-neck area has an awful lot to do with it.
Well, back to the thinking outside of the box, because I would say that's kind of what you do. You're thinking outside of the physical therapy box.
Right.
And to respond again to what people say when they see this in the next segment, the things that you're doing, that this is a gimmick, it's a hoax.
Well, I don't have that much of a problem with that with patients. The patient is coming to me because he has pain, and he's already knows that I'm a physical therapist, that I'm going to do something, okay, from a treatment standpoint. So what I do is I explain the nociceptive examination, and basically what I tell the patient is I'm going to look at you differently than you've ever been looked at before. And we're going to find things that you didn't know you had. And the best way I can explain this is that if I tap on your knee and you get a response and your knee jerks, the typical knee reflex that the doctor checks, there's a circuitry involved in how that works. Well, sometimes that circuitry becomes uploaded, becomes hypersensitive, and pain gets attached to it. If I can then download that sensitivity, pain has nothing to attach to, and it goes away. So we're going to see if you have that. We're going to find out if you have some of these regions, and then we're going to treat you with about 6 very non-painful techniques and see if it helps. We'll come back and examine and see if you're better. Does that sound like a deal?
Sounds like a good deal to me.
Right. So I don't have any problems with, you know, people, because I'm telling them up front it's different. I'm telling them that I'm going to look at all of these areas. I'm telling them we're going to do some very non-painful, non-invasive techniques to see if it helps. And then they're going to give me their feedback back and forth. So they're a part of this picture right up front. And in some cases...
And a lot of times, if they're in pain and they've been in pain,
right.
people are a little bit more open-minded because they just want to stop hurting.
It depends on how I'm relating to the patient, because I've got to sell myself rather quickly up front in order to do an evaluation and get to know them a little bit, because I'm in close body contact looking at what I'm looking at. And so sometimes I tell people, I say, now I'm going to do some things that are going to seem just a little bit weird. Just bear with me. Let's see if it helps. If it doesn't help, we'll get off of this. We'll do something else.
Because if it doesn't work, then you may go to more standard, traditional physical therapy techniques. Now, we talk about the exam.
If I can interrupt you there.
Yeah,
it does help 70 to 80% of the time.
70 to 80%. Those are some good stats.
So 20% of the time, or in that neighborhood, it doesn't.
So it doesn't work for everyone?
No, no. It is very appropriate for musculoskeletal problems, any kind of neck pain, back pain, joint pain, any fascial problems respond very well to this.
Fascial, what's that?
Fibromyalgia. Fascia is the stuff that holds us together. Every individual cell of the body is wrapped by fascia. If you could take the fascia out of your body and everything else stay, and just remove the fascia, you would stand up. That's how intricate it is. And it can get twisted and wound and get tight, and so there are ways of releasing that.
So 70 to 80%?
70%
First treatment?
Usually
how many does it take
treatment,
before you know?
It depends. It's 70 to 80% of people respond to this if it's appropriate for them, and within 2 treatments I'll know whether it's right or not. Usually the first treatment, anywhere from 40 to 60% improvement in the first treatment.
So by the 3rd treatment, you would say if it's maybe going to work for this person or not? Can you tell by the 3rd treatment if it's something?
4th at the absolute most.
At the absolute most.
Right.
Now some of the things that I've read about, and I want to talk about the 3 Gs and the 3 Ts, because these are the things that are attached to these reflexes that you talk about, and that's what people do in response to the treatments that you're doing. So just tell me a little bit about those.
Well, there are responses that people have when you have pain. One is a groan. That's easy to understand. One is a gasp. It's kind of like a snake, you know. You do like that. The second or the third one is a grab, where you grab somebody, and I forget the 4th one. Whatever it is, but there's
grimace.
The grimace is where you just make a facial response, because of the pain.
And usually the gasp and the grimace go together. Because it's natural. It just happens.
It's a natural response. Now some people. There are people who somebody will come up and they'll say, "Well, how are you doing?" And they'll tap them on the shoulder, or they'll maybe come up and rub the back of their neck or whatnot. And people go, "Oh, don't touch me there. That's so sensitive."
Right.
That's what I'm talking about. That's a hype. When they did that and they got away from that, that's a withdrawal reflex, and kind of a startle too, because they weren't expecting it. So that's a heightened withdrawal and startle reflex, and may respond very, very well to PRRT.
And so that would be something, if somebody, you're doing that exam, let's talk about the exam. How do you do that? How do you know the exam? How do you do that?
You get the 4 Gs. When you're doing the exam, plus
so you just start. Where do you start?
You start at the coccyx, which is the tailbone, and you move all the way up to the top of the head. It takes about a minute to do it, to find where the trigger regions are, and usually it occurs more on the left side in the lower part of the body, more on the right side in the upper part of the body. And your next question is going to be, why is that? And I don't know. We don't know why it does that.
Well, and I read something. It's talking about conditioning, trading movement for the pain. Say that I have neck pain and I hurt, and do I condition myself to holding myself that way, to keep my muscles tensed up, and my body's conditioned to stay that way, and maybe that's why I hold the pain stays? I
think you could look at it more from the aspect of homeostasis. Am I balanced? Am I in a relaxed state, or am I in a hyper state all the time? Am I revved up all the time, or am I more relaxed? And then the other concept to look at would be congestion. Do things flow the way they're supposed to flow as far as my body is concerned? If a muscle stays slightly irritated and tight all the time, people that say, "Oh, I got tight in my neck, I'm tight all the time." So if that stays tight like that all the time, do you think it's getting proper circulation? Do you think it's getting proper lymphatic flow, trying to get rid of the metabolites in the body that it needs to get rid of in order to decrease pain? No. It's doing some, but it's not getting all that it needs. So
what does my body do with that then? I just stay that way all the time?
It can be a result of a number of things. It can be physical, it can be emotional, it can be psychological.
What about stress?
Stress, big one, most definitely. The current pain literature is saying that anywhere from 60 to 80% of medical conditions are caused by stress. Not related to, not a part of, but are caused by. So the stress component is extremely important. And if you're hurting all the time, are you going to be stressed out? Most definitely.
Pain causes stress.
And same.
So it's this vicious cycle that keeps going.
Keeps reverberating, yes.
Well, we talked about the conditions. Can you just go over some of the conditions that it works on the best? I did a show on fibromyalgia, and that was one of the most popular shows that I did. Every time it aired, someone called and asked to air it again.
Right.
That's one. So if you have fibromyalgia out there, this might be something that you could try that might help you. And how does that, because it's based on all of the points on your skin, how does it help you just by releasing tension and testing those reflexes again to see if the fibromyalgia is tied to your reflexes? That's kind of a hard question, I know, because I don't...
Well, number one, we don't know what causes fibromyalgia.
Right.
Number two, 80% of the people that suffer fibromyalgia are women. So what is the difference between a woman who's suffering fibromyalgia as opposed to a man? I think in my career I've seen one man with fibromyalgia. No, I take that back, two. So there's a connection there with the female body as to why fibromyalgia is there. And some researchers are saying it has to do with a woman's general nature, which is to be compassionate and caring. And usually in most cases, and this is not a proven fact, but they're the ones that end up taking it. They take it from their husbands, they take it from their male children, sometimes they take it at work, whatever the case may be. They're the peacemakers, okay? Now, that's the emotional.
So that has to go somewhere.
It has to go somewhere.
Okay.
So there's an emotional component there. Now, that's not usually talked about much, because when the patient comes in to see me, that's not what they're going to start telling me, because they don't know.
Right, we
don't know. They just know that they hurt.
And what about TMJ, the lockjaw?
Well, let me get back to fibromyalgia again, if I can. I don't mean to. But the fibromyalgia has a real high incidence of reflexes being uploaded. So is it an emotional side? Is it a physical side? Is it nutritional? And we tend to look at all of those and try and see if there are ways that we can help this, because when you're releasing reflexes, not only do you release the reflexes and you're thinking about that from a physical standpoint, but the startle and withdrawal reflex is also intricately tied to the emotional and psychological. So there are times when I have done things physically, physiologically, and I have an emotional response, and someone will cry after it's over.
And maybe psychological. What about depression?
Yes.
Because I think that once somebody gets rid of their pain,
exactly,
then they maybe not be as depressed as before, because they're not hurting
They're
as
all
much.
interwoven.
Right.
And the interesting thing about what's happening in the medical profession, and this is not widespread yet, but what's happening in the medical profession, we're starting to look at people more as a whole component. When I went to school, I was trained, okay, if they hurt in the shoulder, you treat the shoulder. Well, that's not necessarily the case.
Right.
It could be pain coming from somewhere else that's being referred to the shoulder. Well, we kind of know that
the
from...
brain does amazing things.
We kind of know that from trigger point work, okay? Right. But reflexes infect the entire body. And that same system, if you're revved up all the time, are you going to have a tendency to be a little anxious?
Right.
Are you going to have a tendency to be a little bit
stressed,
maybe depressed, maybe have panic attacks? I mean, is all of that fitting together? Sure, if I'm stressed and tight and tense, then all those other factors can play another role, can come into and make it worse. And if I release one component, is it going to affect the rest? It could.
Now this uploading, we just have a couple more minutes, but this uploading is where the reflexes stay heightened. Mm-hmm. And then downloading is where you're just going to release, those.
Right.
So that then the pain maybe can be released and they don't hurt anymore.
Right.
So just to touch that, one last thing, talking about insurance. Is this covered by insurance? Are the treatments about the same amount of cost as standard physical therapy, or how does that work?
Yes. All insurance companies, Medicare, cover this. It's a manual therapy technique. There are several things that fit within the manual therapy realm, and this is one of them. This is just an advanced manual therapy technique that we utilize and charge it in that particular fashion. If somebody wanted to come see me and pay out of their pocket, it would be about $125 in that range for a treatment.
And would that be standard for any kind of physical therapy that
Yes.
you would get?
Mm-hmm.
And so would you have to have a doctor's referral, or can you just come in and say, I saw this on TV or I heard about it and I want to see if it works for me?
If you have insurance, 90 to 95% of the insurances to pay require that you see a physician first to pay. There are some that don't. They just give out certain number of, you can get 10 treatments a year or 20 treatments a year and you don't have to have doctor's referral and we'll pay. But those are very few and far between. So 9 times out of 10 you have to have a physician's referral in order to have the insurance pay. But as far as me performing PRRT or treating you, I do not need a physician's referral to treat you in the state of Kentucky. We have treatment without referral from a legal standpoint. It's just that insurance won't cover it unless the doctor gives you a referral.
Okay. So we're going to take a break here in just a second and see how PRRT works on me. And you said, let's just reiterate again, the first treatment, what percentage does it work?
Usually between 40 to 60%.
Okay, but it doesn't work on everyone, 10 to 20%,
Right.
You said, and then you would go to some other more traditional types of physical therapy.
Right.
Is there anything that we haven't covered that you wanted to talk about?
Well, the other thing that's interesting is that in some cases, people have other disease processes that are on top of musculoskeletal problems. For example, if someone had low back pain and then suffered a stroke, or someone had low back pain and then suffered Parkinson's disease, some scenario in that regard, you can still treat the musculoskeletal pain with this, even though there's another neurological problem that's overlapping it.
Okay.
But the musculoskeletal area is where this is the most effective so far. The work is very, very new, and there are some good positive results I've gotten with some neurological patients, but not near as effective as it is in the musculoskeletal and fibromyalgia patients.
Wonderful. Well, I know that I have some family members that have fibromyalgia that they're really going to be interested in this show, and they may be wanting to come and see you. So stay with us. We'll be right back, and we're going to get the physical therapy table out, and Gary's going to see how PRRT works on me. Stay with us. Welcome back to Healthy Living. I'm here with Gary Brown, physical therapist, and we're talking about the physical therapy treatment called PRRT. Tell us one more time what it is before we get started on my demo.
PRRT stands for Primal Reflex Release Technique.
And we're working with the primal reflexes, which are the startle and the withdrawal that we talked about. So, okay, I'm going to play devil's advocate, and I'm going to really see if this is what you say it is, Gary.
Good. Good.
All right, so what do I do?
Okay, tell us in 30 seconds while you're on the table.
Well, I have neck pain. My neck is always tight and it hurts. I have low back pain, and I have bad feet, and which makes, if I walk a lot, my knees and then my low back will hurt. So.
Okay. All right. So what we're going to do is we're going to do the same thing that I would do in the clinic. Okay. So let me have your glasses.
You don't want me to see you?
No. I want you to lay on your back, put your head right here for me.
Okay.
There you go. Now, we're going to look at this differently than you've been examined before. So what we're going to do is we're going to look at your reflexes. The best way I can explain this is if you go to the doctor and he taps your knee and he makes it jerk, there's a circuitry that's involved there. So what I'm going to do is I'm going to check that circuitry. Well, sometimes the circuitry throughout the body gets uploaded, and pain can get attached to it because of trauma or stress or injury or disease. If I can download that reflex and make it more comfortable, less reactive, the pain has nothing to attach to and it will go away. So that's a real easy, simple explanation trying to explain what we're trying to do.
Okay.
So first of all, we have to find out if you have these trigger regions. We're going to find that out first, and then I'm going to do 6 basic techniques and see if these affect your trigger regions and make them less sensitive. Okay?
Okay.
All right, very good. So we're going to start at the lower part here, and nothing at the tailbone. A little bit of a restriction on the left at the SI joint. There it is on the left low back. Here it is at L1, and at the T11, T12 ribs. She has an interesting phenomenon right here when you do this. She doesn't like that. I can do this over here on the other side, and she's a little ticklish, but she doesn't react near as much. At the top of the chest. So when she reacted like that, what would you call that? That's a withdrawal reflex. She can't go through the table, so she tried to get away from it the best she could. There it is on the right side again, right here, top of the neck. She's tender on the right. There it is again. And this is actually crunching. She's trying to get away from me. You see that? There it is right here. Not bad in the head, but it's on the right. There it is on the right again. That's on the right here. Tender on the right. This one's a little bit restricted. Let me see your hands. She has it on the left over here in the hand, and she has it in the left leg, but not the right. Okay? So that took us about a minute to take a look at that, so we're going to see if we can take some of this away. Okay?
Okay.
All right. Now, what I'm going to do to you is going to seem just a little bit weird, odd, different. You haven't experienced this before, but none of this hurts, so bear with me, okay? I want you to hold the pencil like this, hold your thumb like so. I want you to take your feet and push them down. Hold them there for me. Don't let me push your toes up. Hold your toes down. Good. Now, before going any further, remember how tender you were down here? Is that better?
Yeah.
How about this here?
Still a little tender.
Still a little tender?
Yeah.
Okay. Difference? You notice the difference?
I noticed the difference in laying down.
Yes. Okay. All right, now, raise your eyebrows for me. Close your eyes. Keep your eyebrows up. There you go. Close your eyes. Don't let me open them.
Close my eyes.
Close your eyes. Good. Now, we're going to turn your head to the right, just like this. Turn your head to the right. Hold it there for me. Don't let me push against you. Take your tongue and put it between your teeth like this. There you go. Hold. Turn your head to the right. Hold. Tender.
Mm-hmm.
Relax. Just easy. Keep pushing. Good. And relax.
So, in pushing, am I supposed to be tensing through here?
You can.
Okay.
All right. Now I'm pulling her hair, and people will say, why do you pull hair? Well, the interesting thing is that the covering on the brain and spinal cord actually goes up and invests itself in between the sutures or the plates of the brain. And when you pull hair, you're releasing that.
What is my hand doing?
Your hand is helping to release the reflexes in the upper part of the body. There you go. Now, tongue between your teeth. Relax. Good. All right. Now let's see what we were able to do. How about this now?
There.
How about here?
It's still a little tender there. Yeah, it hurts there.
How about this?
That's funny.
What happened?
I don't know.
Thought you were real. You didn't like that a minute ago.
No, I didn't.
All right. How about here? Feel the difference? Yeah. That is still a little bit crunchy right there.
Yeah.
Yeah. How about this here now? Much better.
It's still a little tender, yeah.
Now the tenderness I'm not worried about. It's the pain. It's the wanting to get away that I'm worried about. So if I do this, you can still feel tender, but you're not wanting to go away from it like you were. And remember, we're after 40 to 60%, not 100% relief in the first visit. See? We've got to give the body a chance to catch up with what we're doing. And Mother Nature, once you start this process, will kind of catch up and try to help improve it even more after you get through. There you go. Now set up for me.
I know my hair looks great now.
How do you feel?
I feel better. You know, you want to say it's not real because it seems so bizarre to have that happening. Though I don't even know what all of this is. What is this? I mean, it's
your face.
Well, I know. But the strange techniques. I mean, how does that work with that? I don't.
Well, let me give you an example. If you get startled, what do? Like that. So my eyes fly open, my mouth flies open, my eyebrows come up. So if I have you close your eyes and try to open them, isn't that the opposite of what you just did? So that's a downloading effect from a response that was a startle.
So how about my low? Because my low back really was. I mean, I can still feel a little bit, but it does feel really much better than it did before.
Right.
So what did you do for the low back? I mean, was that the feet?
Yes,
the feet thing?
What you're trying to do is you're trying to regionalize this, and you can't. What you have to do is look at this as a total effect. I know. But sometimes I can do the feet, and I can take care of neck pain. Sometimes I can do the neck and take care of back pain. So it's not, okay, you do this for the back, and you do this for the shoulder, and you do this for headaches. It's not the case. The reflex system is all related. It's all intertwined. So I may be able to clear the problems you're having with your upper back by releasing your tailbone, if I have to treat that.
My neck feels better. Yeah. It feels looser.
Right. Do you feel warmer?
I do. I feel warmer and I feel a little lightheaded.
Okay, that's normal. That's an endorphin release that you get. Kind of like the body has its own endogenous, which means inside, opiates. Everybody understands that. So it has its own endogenous opiates. And so when you do this, sometimes you get what we call an endorphin release. You've heard of people say when they run, they get a runner's high. Same idea. But the body will create an endorphin release. You'll get more of it if you treat the neck than if you treat the middle back or the lower back. Same thing happens if you go to the chiropractor. If he manipulates your neck, some people feel very relaxed and they get this kind of feeling. And that's because you're creating an endogenous release of opiates when you do that.
Well, it was kind of used to chiropractors. They were thought of to be quacks too years ago, and now it's in the mainstream more now. And this is maybe where PRRT is going.
Yes.
And say that I had surgery or something like that, and I had something wrong, and you did PRRT for that. Would there still be things that you would need to do from another physical therapy standpoint, as far as strengthening and toning and doing those kinds of things? Is what I think a physical therapist does.
Well, there's several things we look at in an evaluation. You want to look at joint range of motion, you want to look at muscle strength, you want to look at any clinical findings. Is there any heat or skin irritation or anything that fits outside of the range of motion muscle testing realm? Is there any neurological problems? Do you have any numbness or tingling? And then functionally, what can you not do? What are you having difficulty doing? Well, I can't reach up into my cabinets, or I can't clean my house appropriately. I can't get in the car the way I used to. Whatever it happens to be functionally, kind of make a note of that. So all of those things are what you're concerned with. Now, what you then have to do as a physical therapist, in my profession, is you then have to say, okay, what can I do to make the biggest impact on that? So if I want to make an impact on range of motion, muscle strength, neurological findings, and their functional activity, if I release your reflexes and that dramatically improves all of that, then that saves me having to go through all this other stuff I know how to do to get to the same result. It's just quicker. All we're doing is we're taking physical therapy, approaching it from a different manual standpoint, putting WD-40 on it, and getting there quicker.
WD-40. It's the WD-40 of physical therapy.
Huh? Yes. Yes.
Well, I really am impressed, Gary. I was playing devil's advocate, but I genuinely feel better. So I appreciate that. If nothing else, that's the best thing out of this show that I've gotten. We're going to take a break and come back with two patients who have seen Gary and talk about how their life has changed since PRRT. And we'll be right back. Thanks, Gary. I appreciate it. Thank you so much.
Very good.
Welcome back to Healthy Living. I have two new guests with me now. They are physical therapy patients. I have Shirley Ford and Karen Payne. Thank you for joining me. And we're talking about the physical therapy technique called PRRT and what it's done for you. And that is, again, is Primal Reflex Release Technique that we talked about with Gary Brown in the first two segments. And I want to tell you that now I'm a believer in just the fact that my neck is much better than it was. I can actually probably look out and check my who's coming up behind me now without having to turn my whole body to look outside there. It's amazing, truly. So first of all, just tell me what brought you to see Gary in the first place, and tell me a little bit about what your pain was like. And go ahead, Karen.
I had 2 surgeries to repair disc in my neck, and the surgeries helped the disc problem, but it didn't help the pain really. And I'd gone through lots of physical therapy. My doctor suggested physical therapy again, and I went to the place that I normally have physical therapy, but it wasn't the same group there. It was Brown Physical Therapy. And I thought, well, I'll try it. And I was amazed even after the first visit that, because I thought it was strange, and you know, I thought this isn't going to work. But
now you thought he was.
I thought, yes, I told him after like the 3rd visit. He asked me what I thought, and I said, well, honest, I said the first time I was here, I thought you were a freak. And after the 3rd visit, I began to think he was a genius. So it improved the quality of my life and everything. I mean, it's every aspect of my life. It's changed.
Shirley, tell me a little bit about what brought you to physical
Well, I
therapy.
had shoulder surgery, and I was slow healing, and that threw me later getting in. And when I first went to Gary, I could get my arm no further than there, and it took him a good little bit to be able, where I could get my strength to lift my arm up, but I wouldn't take anything for what they did for me. And
so you couldn't move your arm because you had a lot of the surgery in
Yes,
your shoulder took a
yes.
long time for you to heal.
yes.
And so it's almost like your arm stayed there as a way to
it was
protect
just almost
itself.
froze, you know.
You couldn't move it. It hurt too bad. It hurt too bad to move it. And so the first time you walk in the door, now I had told Gary that I had seen on the website, and I thought, I am so sure this has got to be a gimmick. And you said you thought that he was, because he says, okay, I'm going to try something a little bit
Right.
new, and even when people say that, you're like, okay, I'm hurting and I've been through physical therapy, but I'm going to try it. I mean, how many physical therapy things have you gone through?
Well, I went through about 5 or 6 weeks of it, but after the 3rd visit, I had movement in my neck that I hadn't had in probably almost 10 years.
10 years?
10 years, because I had gone through the surgeries and physical therapy and everything for 10 years of battling this. And
I mean, what was your range of motion?
very little. Well, like you say, looking behind you just to back out, I couldn't do that. I had to turn my whole body or use mirrors to drive, because I had no range of motion.
And you just, after 10 years, just think, this is it?
I did. I had
is
give
it.
up hope. I really had. I had begun to think that this is it. This is as good as it's, after the 2nd surgery, and it didn't get any better. I thought, this is it. This is as good as it's going to get. And then when I saw Dr. Brown, I'm like, okay, it is better. You can be better.
So for those out there, who say, I've tried everything and nothing works for me, what would you say to this person?
I'd say try Brown Physical Therapy, because you'll be amazed.
Because like Gary said, he's the only one in a 5-state area that's practicing PRRT. Shirley, tell me about how your life has changed, because you couldn't move your arm.
Tremendously. I was just one arm.
And what was that like, going around just trying to be with one arm?
Awful. And then he helped me over that, and then I started having bad back problems.
Okay.
And I went back to him for that, and I done reached the point where I just thought I was going to get to where I was going to have a wheelchair.
Really?
Mm-hmm. And so I started, I think it was in January, and probably along about the last 1st of March, I think, while they dismissed me. And just, I can do things that I haven't been able to do in a long time. And, you know, I have a little pain every now and then because I've got arthritis in my back. But outside of that, I'm doing fine.
So how many treatments before you noticed a difference of the PRRT?
Oh, I'd say 2.
Now, was it after 2 that you could then raise your arm?
No.
No.
No. But the pain, I could tell that, you know, the pain wasn't as bad.
Okay, so that's where he started.
Yes.
And that's what he was talking about in the segments, that we had to get rid of how the reflexes tied itself to that pain before he could move, before he moved on
Right.
to dealing with the other issues, because he had issues of strength to deal with you,
Yes.
Shirley, right?
Yes.
So talk a little bit about that. Then he had to move into the more standardized kind.
Well, I was going there and doing therapy, and then I had ropes, you know, and things at home, exercises that he'd give me at home too, and you know, just going and not following up on what he tells you to do, you might not do as well, you know. But I tried to keep up my exercise at home just like I did, you know, when I went there, because I wanted to get better.
Right. So he had something at home. Did he show you these techniques?
Yes, yes.
The what kinds of things? Because I would imagine that everybody's kind of different on the types of things that they would do at home, depending on the pain and the problem they have. What kinds of things do you do at home?
With the shoulder, I had ropes that you hook into the door and pull to give me some strength. And
that was working more probably of a traditional.
Yeah, well, it was just keeping up what I was doing when I was there.
To build the strength back up in your shoulder. Now, what about your back? Do you have to keep going back for the shoulder and the back?
No.
No.
No. No.
It's gone. The
It's
pain is gone, and you don't have to go back.
No.
What do you think about that?
I think it's great. I would refer anybody to them that wants to get better.
See, I think that because you don't have a lot of results like that you say you don't have to go back. How many treatments for your neck before? Do you have to keep going back for it?
No. Like I said, he has given me exercises and techniques to do to help with the pain if, you know, it reoccurs, and it does occasionally. But I know how to deal with it now. I know what to do to take care of it.
So what type of exercises do you do at home? Did he show you?
Well, he's got a lot of the facial things that you do that helps with that. I do a little bit of strength training because of my left arm. It's just, some of it I tell him is kind of like meditation. It's, you know, kind of.
So it's almost like a holistic approach.
Yeah.
Type of thing that you do these things, and plus you kind of meditate, and it's changed your whole perspective on the way you deal with yourself physically as well.
Right.
Would you say? So again, the advice that you would give to someone watching.
Give it a try. I mean, you know, like I said, I had nothing to lose, so I'd done everything else. Give it a try.
Done everything else.
That's
to
right.
stay open-minded.
Yeah, stay open-minded, absolutely.
All right. Well, listen, I just want to thank you for joining me. Some of the things that he had said to me was that the cliche that seeing is believing. Well, seeing isn't believing, because when I saw it, I was no way. He said that what he says is experiencing is believing. And so I can say from personal experience that I do feel better, and I really almost didn't want to say that I did, because you almost want to say no, that didn't, and so you want to say no, that's not true, but you can't, because it really did make me feel it looser in my neck. Now I don't know, I'd probably have to go back for, you know, the second and the third treatment, and that's kind of what you did. You went back 2 and 3 times, and your life is different now. It changed. Better. On a scale of 1 to 10, what would you say? Where were you before?
Oh, about a 3. I'd give it about a 10 now.
Yeah.
Wouldn't you? 11.
Yeah.
11. Go over the scale. Go over the scale. Thank you, ladies, for joining me. I really appreciate your time, and I am so glad that PRRT was so successful for you. But I'm going to bring Gary back on and let him talk a little bit about how he dealt with each of your situations and any other topics we might have missed. Thank you again for joining me, and you stay right where you are. We'll be right back with Gary. Welcome back again. I am back with Gary Brown, again the physical therapist who is telling us all about PRRT. And wow, do you have two advocates for you in Shirley Ford and Karen Payne. They really talk well about you, and me too now. Me too, I will as well.
You're a believer now?
I'm a believer now.
Right.
I've experienced to believe. I think it's
Exactly.
really neat. It is.
Exactly.
But I wanted to talk a little bit about how you dealt with each of their situations, because they both had surgery, whereas I didn't have any surgery.
Right.
So how do you approach each one of those ladies differently? And they talked about home therapy.
Right.
And how do you, I mean, that's a gift to give that to
Right.
them to take home.
Well, first of all, I wouldn't approach someone like yourself who had not had surgery and someone like Shirley or Karen who have had surgery really any differently.
Oh, okay.
The reflexes are going to respond in all three of those cases. If they're going to respond, they're going to respond. So you don't really have to say, okay, with surgery you do this, and with a non-surgical patient you do that. You're basically wanting to find out what has the body done with what's happened to it. So if the body's been invaded because of surgery, if the body's been invaded because of stress, if the body's been invaded because of some trauma, there's really no difference. It has the same effect on the autonomic nervous system, and that's what you're assessing, is you're trying to find out what the reflex system has done with what's happened to the body, regardless of the cause. And from that point, then see if you can make it less sensitive.
So Shirley couldn't move her arm.
Right.
She couldn't move her arm when she came in to see you. What was the first thing that you thought about, okay, this is what we're going to do. We're going to do the reflexes. And she said, did she know pretty quickly that it was going to work for her, or did you know? Because you said it's one or two, you said something about you fail fast. So how
The interesting thing about PRRT is you're dealing with the reflex system, and you know, when the Lord put us together, He didn't mess around.
No. Well, we
And
have three
as-
of those systems you talked about.
That's exactly right. But that system is quick. It's fast. If you withdraw from something, it's quick. If you get startled, you startle quick. Well, if you get it that quick, can't you unload it that quick? The concept is, yes, you can. So if you can pick it up quickly, there's a way you can release it quickly. God does things quick. So this technique works very, very quick. If it doesn't work, then there's something else that's keeping it from reacting. So we move off of this and try to look at other areas that may need to be addressed. So if in one or two treatments you're not better, at least 50% better within one or two treatments. I'm starting to think maybe PRRT is not the total answer for this. We've got to move into some other areas. Now that doesn't mean I won't come back and try it again later but the reflex system is actually diagnostic. If I cannot get it to let go, then it tells me something else is going on that I need to look at. Like for example in Karen's situation, she had a disc. Now I could have probably helped her with PRRT before the disc was operated on, but I couldn't have gotten the results that I'm getting now because the surgeon had to go in and actually remove where the pressure was that was keeping the reflex uploaded in her body. So my results
So it was a double thing, the medical standpoint.
It all works together. But if I fail, what I mean when I say I fail is that I find out if it's working or not working. Instead of going 10, 12 treatments to find out, well, are you any better? No. We're going to find out within 2 treatments, 4 at the absolute most. But most of the times it's 2 treatments, whether this particular technique is going to be effective for you, and if it's not, let's move off of it, let's get into something else.
And that's okay with you?
Yes,
it's okay.
that's fine.
Because sometimes when physical therapists or doctors get their mind on one thing,
Right.
it's that or nothing. This
Exactly.
is it or it's nothing. And you don't feel that way.
No, but the interesting thing about PRRT is it causes you to make a paradigm shift.
Okay.
Because when I went to school, I was taught when shoulders hurt, you look at shoulders. When elbows hurt, you look at elbows. And what I'm doing now is I'm not looking at the segment that they're talking about hurting. I'm looking at the total body. I'm looking globally. So what's the global effect? And if I treat this globally, can I have a peripheral effect, like in a shoulder or an elbow, and make it better if I treat something that's more central? Well, you can't get any more central than your reflex system. So if the reflexes are involved and I get them quieted down and the shoulder pain goes away, there's a direct contact between the reflex system and the shoulder. In Shirley's case, it helped greatly to improve her range of motion. The first time we did PRRT, I was flicking her neck in order to decrease the impulse of a short muscle in the neck. And after doing that, she went from here to here in one treatment. Now, we still had issues of strength.
Right.
So once we got the motion, then we started working on the strengthening part of it, and I showed her ways that she can download this same reflex that I stimulated in the clinic, how she could do that to herself at home and keep it down-regulated because we still had some strengthening to do.
Well, talking about that home therapy, to do that, you actually do. You depending on the patient, depending on what they need, those things that you were doing, you show them how to do it, so then they don't have to come back to you necessarily.
Yes and no.
Yes and no.
There's the home program is to help it take a total effect. I mean, it's like going home and if you do strengthening in physical therapy and you don't do any strengthening at home, you're with me just a short period of time over a 24-hour period of time. I'm seeing you 3 times a week. I've got 48 hours before I see you again. If you're not doing anything for the problem, then I'm working uphill every time you come in. So if the body is upregulated, when I do one technique, I'm not going to down-regulate it totally, because you are, if you were a 10 when you started today and we did that on the table, what are you down to now? What's your essence of what you're down to?
5.
5, so 50%.
5 or 4.
So usually between 40 to 60% is the improvement. You have a 50% improvement. Now, wouldn't you like to maintain that?
Right.
Because we're not totally there yet. So I'm going to show you things to do to help maintain and even make that better, if that's what the reflex system needs. Then when you come back, we're going to find out, well, how did that work at home? Are you better than you were? Are you about the same? Did you lose a little bit of it? What else do we need to do in order to keep stimulating this relaxation phase of the autonomic nervous
And
system?
if I want to come and see you and have the insurance pay for it, we talked about that. I would need to go see my primary care physician, and she would have to refer me to you so that my insurance would pay for the treatments.
Yeah, they don't have to ask for PRRT. That would be fine. They can just say physical therapy, you know, evaluate and treat, whatever the case may be, and we can handle it from there. We'll take care of the paperwork.
One last question. We have about a minute and a half left. Talked with Shirley, talked with Karen, and their lives have dramatically changed. They're different now, thanks to these techniques that you've learned. How does that make you feel?
Well, it's very gratifying, because for the first time, this particular technique, when it's right for the patient, taps into a system that has never been looked at before. And when it's right, it's quick. It's very, very quick. And we are merely applying things that we haven't known in the past to a particular problem to make a faster response for the patient. And that's what physical therapy is all about. Anybody that's in the healing business, that's what they're about, is to try to help people. This helps people quicker than anything I've ever seen. So it makes me feel great, feel good. I feel better for them than I do for myself, but it's very gratifying knowing that this is what I was trained to do, was to help people and heal people. And when I can't, it becomes very frustrating. I now have another major tool in my toolkit to be able to use with people to help them achieve those goals quicker.
Well, I think that's awesome. And I appreciate your time, and I appreciate my demo.
Oh, you're quite welcome.
I feel better. Thank you. If you have any pain that you deal with on a daily basis, maybe PRRT is for you. Don't just stay out there and hurt without trying to be open-minded and give this a chance. But go see your primary care physician and ask maybe to be referred to a physical therapist. And maybe your life can be changed like Shirley and Karen's. Thank you for joining us. I'll see you next time on Healthy Living.